Welcome back, Facebook friends of the Plastic Surgery Group. We're back once again live with another edition of Facebook Live. I'm Terry.
I'm Joyce.
And today we are so excited because we're going to talk to you about breast augmentations.
Breast augmentation is one of those procedures I still get so excited about year after year because in all the years I've done this, and it's been many, it's the procedure that I think women desire from the time they're teenagers, and Lord knows we've seen, I think you've even seen a patient in up 70s, is that right? Maybe even older than that. So it's one of those things that women, maybe secretly want to do forever and just don't make the time to get in and have a consult about it. So this is your golden opportunity. We are thrilled to be able to offer you the best prices in town, and we've got 6 phenomenal physicians, 3 locations, and just the greatest deal right now. If you haven't checked it out, it's 40, what is it? 5,000 all inclusive. Plus you get a free area of Botox or a filler as well. So it's like prime time to look into it. And as I said, it's complimentary consultations. And so we're here kind of with Dr. Columbus, who is just phenomenal physician. Been doing this for years. He'll go into more details about his credentialing, but we feel that because this is a procedure that we do all day, every day, you're just getting the best possible treatment here, and follow-up is great, and everything is included in that pricing that I just quoted you. Mm-hmm. So please make an appointment to come in for a consultation, and we're going to kind of turn this over. It's kind of Breast Augmentation 101, so it'll be kind of what we do in a consult room, and that's where we are right now in actually Dr. Columbus's consult room here in the Red Bank office. So Dr. Columbus, kind of tell us what you would do on a normal consult.
So breast augmentation, I think most patients come having made a decision that they're ready to proceed, and they're kind of here to interview us and get a feel for where we think they need to be with their breast augmentation. It's an individual, unique procedure for everybody. It's not one size fits all. Everybody's body is their own, and that's how we approach it. Essentially, we go through a discussion of the reasons why to do augmentation, how we do the augmentation, and then the important anatomy of the individual patient as to how we're going to pick implants for that patient. Essentially, the patient's frame determines where we can go with implants. The width of their chest is really the most important thing that we can look at to make sure that the implants actually fit on their chest and they're not either coming together in the midline over their breastbone or going out underneath their armpit, which patients don't want. So we'll answer their questions. We go over the different types of implants that are available to patients: saline, ideal implants, and silicone implants. We go over the different styles of implants, from a athletic look to a fuller, higher profile look, to get the patients to understand, where they can be with those implants. Answer all their questions, go over implant manufacturers' warranties, follow-up routines and regimens, imaging studies down the road to look at implants as they get older in the patient's bodies. And then we'll go to an examination room where we're going to examine the patient and measure them. And then they're trying on implants based on their measurements. We've gone to our list of implants. We have multiple sizes, multiple styles of implants for the patients to try on. And they get to try those on and figure out the look that they're looking for. And it happens that day at that initial consultation, and then again when they come back for their visit right before surgery, they're going to usually try them on again and make sure that they're good with what they've picked for their sizes. So it's getting input from the patients. We're explaining why we're doing what we're doing, why a certain size is appropriate or may not be appropriate for them based on their body and their body type.
So I think everything that he said is so critical to making a decision on what physician you choose. As I said, Dr. Columbus is board certified. We think that that's critical to getting the best care. Mm-hmm. And he mentioned the implants. We've actually put some on display here. And as he mentioned, it's your measurements kind of dictate what they choose. But this is an educational process, and that's what we pride ourselves on here at the Plastic Surgery Group, is that, you know, when you come in for a consult, it's not just giving you a quote and telling you, yes, we can do this. You will know everything there is to know about what your pre-op is going to look like, what your post-op is going to look like. And I will say, my daughter had this done and had it done on Friday and back to work on Monday. So it's a real simple recovery. And I think the most gratifying thing for me throughout the years, and I'm sure Terry will attest to this, and Leslie, who's behind the camera again, we've all had procedures done, and it's one of the most gratifying things you can do is to see someone transform their, you know, it's kind of a thing that if you psychologically have, you know, bad body image about a certain body part, and there's something you can do to rectify that, I think it's phenomenal, and it's just fun for us to see people, you know, go from maybe a lower self-esteem to be able to, you know, put on a bathing suit that maybe they've wished they could wear for years and finally can rock it out. So we're all about trying to help you have the best experience possible. And as I said, Dr. Columbus is incredible. All the doctors are, and we would love you to take the time to come in and talk about it. Pricing's phenomenal right now, and then we've got the extra couple things till the end of the month. Make an appointment if you can. Come in, and you know, we'll go over some of these things. But as far as some of the questions that people have asked us that we didn't address, can people breastfeed after they've had a breast off?
Yes, generally people will be successful. We're not really doing anything that interferes with their breast tissue per se. If their breast tissue makes enough milk, they're going to be successful. And they certainly can always try.
Okay. What about?
And we always get asked too as well, what's the recovery like after breast augmentation?
For most women, they'll describe it as their engorged feeling like they did when they were, you know, full of milk with a pregnancy. So they're sore and kind of tight for a few days. Most women need a couple days worth of pain medicine, but usually we're seeing them back anywhere from 1 to 3 days after their surgery to check on them. And usually by the 3rd or 4th day, most women have given up pain medicine. They're up doing things. They're not stuck in bed. They're not having horrible pain. The biggest thing we usually do is it's a couple weeks of no lifting any objects so they don't pull and strain and tear something inside that could bleed, and then they'd have to go back to surgery. That's kind of the biggest risk that we worry about for patients, you know, in the immediate postoperative period with augmentation. So you don't go to the gym for a couple weeks and things like that, but for the most part, a relatively easy recovery in terms of, you know, things that you can do. You could be up and around, you know, really the day of, showering the next day, and you're pretty much in a bra, you know, a sports bra really is what you're wearing for the first couple weeks.
Right. And typically, how long does the surgery take?
Surgery's about anywhere from an hour to maybe an hour and a half in duration. And again, we go over all that stuff with the patients when we're seeing them, examining them that day, so they have a good idea about how much time it's going to take.
And the only thing they really need to do is bring a front closure bra with them to surgery, right?
Right.
There's no
Surgery, we have them bring
a
a soft sports bra that, you know, they bring, and we put that on them at the end of surgery. There really aren't bandages or things like that. So they go home feeling okay.
Yeah.
They're just a little sore.
Yeah.
Wonderful.
Simple.
I know.
Easy.
Simple.
In and out. Yeah.
So don't hesitate again to give us a call. Please come in for a consultation. We have Westchester, Red Bank Road, and Northern Kentucky for your convenience, and we would love to have you come in and give us.
And I think it's a good time because
it is
yeah,
perfect.
Now's
right
the time
before
to do
bathing
it.
For
suit
summer.
season. Yes.
Yeah.
Give you plenty of time to recover and pick out that fantastic new suit.
Completely. So once again, we're going to ask everybody like and share a video because again, we do rely on referrals from all of our awesome Facebook friends, so we really appreciate that. And also, if you could leave a comment, you have from now until I believe midnight Sunday night, you will be entered in a drawing to win a hydrofacial with us here at the Plastic Surgery Group. So another incentive for you all to watch our Breast Augmentation 101.
Thank you, Dr.
Thank you.
Columbus.
Thank you, Dr. Columbus.
And thank you all for joining us, and we'll look forward to seeing you again next month.
Bye.
Bye.